Celebrated today's vote with Trump calling Obamacare a catastrophe. And if you've been covered under the Affordable Care Act, what does this mean for you? Alex Michelson is back with us to break it down with a special guest. Alex.
Yeah, I'm joined now by Rob Fuller, partner of LA healthcare law firm Nelson Hardiman and co-author of the book right here, From Obamacare to Trump Care, Why You Should Care. Rob, thanks so much for being with us.
Great to see you.
Okay, so let's start with that premise. Basically, for people that are trying to understand what just happened today, what does this healthcare bill mean for them?
Does three main things. One, philosophically, it sets the states up as the final arbiter of insurance rules. Secondly, it changes the subsidies that were paid for people who needed some help paying their insurance premiums into tax credits, which aren't quite as generous as the Obamacare subsidies. And thirdly, it seeks to roll back the Medicaid safety net coverage across the country to pre-Obamacare rules over the next 10 years.
And so you've compiled a list of winners and losers, and we can put that up on the screen, hopefully. The winners, you say, are conservative politicians, insurance companies, and digital health companies. Why?
Well, the conservative politicians philosophically get the federal government out of the rulemaking business for insurance and leaves that power with the states. Secondly, the insurance companies, we believe, will benefit by being able to work with states in creating the waiver system that was set up to set the rules more the way they want them to, and we think they will profit from that. And thirdly, the digital health trend, we think, gets accelerated because access is scarce in healthcare right now, and it will be a lot of pressure to make sure that some kind of healthcare is made more widely available.
So whenever they're winners, that means that they're losers as well. You say the losers for this: hospitals, people with pre-existing conditions, and people in this gap between about 45 and 65.
That's right, Alex. The hospitals have to see patients who come to the ER under EMTALA, and we haven't seen the final scores yet, but anywhere between, we think, 24 and 42 million people will lose health care insurance. They're still going to get sick. They're still going to seek health care, and where they're going to seek it are hospital emergency rooms. And the hospitals are required to give them that health care. So the hospitals will have a lot of people who can't pay for care showing up. The folks who are having the
pre-existing
conditions, it's a tougher, more technical discussion. But we think that a lot of states are going to seek waivers that will give insurance companies flexibility to charge those people more when they have an insurance gap. And there's a lot of technical rules to come, but basically you don't have the assurance of pre-existing coverage anymore. The third problem is going to be folks who are 45 to 65, haven't aged into Medicare yet. And what the legislation today does is expand the multiplier on the age bands. It was 3-to-1 under Obamacare, that you could charge a 60-year-old 3 times what you charged a 20-year-old. The law now says 5-to-1 under the bill passed today, and it says states, if you want to move it to 10-to-1 or whatever number you want to pick, come on in and we'll consider that.
Wow.
So folks in that area are going to probably see a premium spike.
Such an important issue. 1/6 of our economy is in healthcare right now. You said you believe that 28 to 40 million people could lose health insurance. That's quite a big story. Thank you for coming in and sharing your views.
My pleasure,
we appreciate
Alex.
it. And for more on that book, it's called From Obamacare to Trump Care, Why You Should Care. It's available right now on Amazon if you want to read more about this very important topic. Ladies, back to you.
Alex and Rob, thank you. I love the title of that book. It's a great one.